Welcome everyone, and thank you so much for coming today for this hopefully really impactful event. My name's Andrew Pinto. I'm a practicing family doc, a public health and preventive medicine specialist, and a scientist here at the University of Toronto. I direct a research team called the Upstream Lab. I have the huge privilege of being one of the applied public health chairs. And I'm really here to help just welcome and start us off. I wanted to begin by just acknowledging the land on which we're all meeting here today, here in Toronto. As many of you will know, this is the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit. Toronto is covered by Treaty 13 and is still home to tens of thousands of Indigenous individuals from across Turtle Island. One of my colleagues, Janet Smiley, has done some really important work to help really us understand that Indigenous communities are throughout Canada. And also part of us being here is also keeping in mind the calls to action of the Truth and Reconciliation Commission that specifically were for folks working in the healthcare system, that we need to work towards reconciliation, also models of care that reduce the harm that Indigenous individuals continue to face on a day-to-day basis. To just begin, there's a huge number of folks to thank for helping make today possible. As all of you know, this type of event, which is bringing people together from across multiple provinces, policymakers, health system leaders, providers, researchers, it doesn't happen without a huge number of folks behind it. The person who has played a huge role in this is Izzy, who's at the back over here. And I just want to say a special thank you so much, Izzy, to your incredible hard work to make this happen. There's also a large number of other Upstream Lab staff and students, Rumi, Gail, Alexandria, Joe, Antonio, graduate students like Melanie, Anne, Jane, Mathieu, Melanie Seabrook, Stephanie Garys, Rose, Kasika, Ella, Jillian, Katrina, Chris, Sharon, Roxana, as well as we have a number of medical student volunteers, which are wonderful. Madru, Ovini, Grace, Amanda, and Karen, some of who were summer students with us at the Upstream Lab. We also had patient partners who helped us with informing today, some of who could join us as well. Mike, Veronica, Donna, Alex, Sager, Kim, and Gabriella. And it's also just incredible, to see how many people came together, provided advice. The members of the steering committee are listed also in the program. People who helped inform kind of how to shape today as well. I also just want to acknowledge that this is being supported by CIHR. And one of our speakers is Rick here, who's going to be talking as one of our scientific directors at CIHR. We have a few other colleagues from the event. We also received support from the Department of Family and Community Medicine at the University of Toronto and the Department of Family Medicine at Queen's University, as well as many other groups that have endorsed and supported this as well. I'm not going to speak for too much longer, but I just had a couple of things to help kind of set the stage. There were three kind of things. One is that we really want today and tomorrow this event, which actually got a huge amount of interest from people to come and to take part in. We want this to be a working meeting. This is not to simply describe the situation that we all know exists, but really to come out of this with plans that actually create action and have impact. We actually all collectively already share a vision of being in a country where every single person has access to high quality primary care. So we have that vision. So a lot of what today is in this work that we're doing is to develop priorities and actions that help with implementation of those priorities. So if we think about it, and if you can hold this in your mind, if we were to meet again a year from now, what would we have wanted to see done? And how do we have local action in each province and territory, but also cross-cutting synchronized actions as well that actually push the federal government and push our provincial and territorial governments forward? The second thing is to think big. This is our opportunity to not be constrained by the system that we have right now, and some of the challenges that we face, but rather to really think about what could be, and then think about how to make that possible. And the third and final kind of point is, when we see new resources starting to come in, and we know that there's a federal government promise of about $30 billion over 10 years. So we see this new funds. The thing that's holding it up is the agreements between provinces and territories and the federal government. But when we see that those funds coming, we don't want to just pour it into the existing structures. How do we actually emerge over the next 5 to 10 years with a system that not only achieves universal access, but is also more upstream and is more preventive? So that's why this event is titled, Addressing the Primary Care Crisis, but also building upstream systems that ultimately are more preventive, ultimately tackle root causes, integrate health and social care. A few final points before I turn it over to Melanie Ann we are going to follow Chatham House rules, where we will be taking notes. We have a number of folks who are helping kind of collect all of the lessons. There will be proceedings from this that will be a resource for everyone, as well as the very specific detailed plans for each province and territory. But we won't be attributing things to specific people. So we want this to be a space where people can feel open. We do have excellent audiovisual support at the back, and we have about 100 or more people who have signed up to join us virtually. So we will try to be checking in, and we have some staff at the back around if there are questions or comments from folks online as well. So that's everything from me, and just a big thank you again, everyone. And I know that collectively, the people in the room here and the people joining online, we have the ability to make a huge amount of change. So I look forward to that.